Hi everybody, I'm Dr. Gavin Scriven. People call me Dr. Gav, and with me is the founder of the non-surgical penis augmentation procedure we call Calibre, Dr. Jason Oates.
Thanks, Dr. Gav, and together we are the Dick Doctors, and we are going to be talking about all things penis. Our area of expertise is injectable penis augmentation. There's a lot to talk about penises, and together, myself and Dr. Gavin will be doing that.
Hi, this is Dr. Jason Oates, and with me is Dr. Gav. This is the Penis Show, and we are the Dick Doctors. We're going to be talking all things penis. And today we're going to be discussing downtime and aftercare after you've had injections in your penis to make it bigger. Hi, Dr. Gav.
Hi, Dr. Jace. Thanks for having me. It's always a pleasure.
Yes, good to. So, this is a common question that guys are always asking is, what's the downtime after I have a Calibre penis augmentation?
Yeah, and it's really important for every cosmetic procedure, really, because everyone's really busy and working 24/7. They don't want any.
You work harder than I do, then.
Yeah, working 24/7. They don't want any interruptions to their social life, to their sex life, and to all sorts of things. So, yeah, really, really good question. Surprisingly, the downtime from our procedure is really not that much. It is a procedure that you can essentially walk in, have the procedure, and walk out. I always start with that and say, you are walking in the clinic, and an hour or two later, you're walking out of the clinic. And you can essentially go back to an office, really, if you'd like to. However, there are a few things that you do have to avoid, and we can talk more about that. But I guess I'll start with the first one is what guys always ask about is sex. Very important. And yeah, so we tell them, look, 5 days, really, 5 days, no sex. I say 7 days a week if you can help it, just to be extra cautious, why not? And really it's because of the little entry points that we make to do the procedure, to inject the filler into the penis, take, up to, in some guys, up to 3 days at least to heal. And then even if they're healed in those extra, couple of days after that, there's always a risk of skin breakage or something during sex.
Yeah.
So we really, really don't want to minimize the risk of any kind of post-op or post-procedure infection. So I say...
However, you must have had patients like me who, that first night, put it to good use.
To my shock and horror, they have reported this, later on down the track when they're having a top-up a year later, and they've been okay, but I certainly would not recommend it. And I reminded them that we did talk about not having sex for 5 days.
Yeah, and the reason is we want to avoid infection. If you don't want to sleep tonight, look up Fournier's gangrene, scariest thing in the world. And it's an infection that happens in the penis and the scrotum and spreads, and all the skin drops off.
Yes. If we show people a picture of Fournier's gangrene after every procedure, I think there'll be no sex for a week at least.
Yeah. So, okay, they can't have sex for a few days. What about just walking around, going to work, that sort of thing?
Yeah. I guess walking around is not an issue if you're not building up or working up a sweat. And also if you're able to just check on the penis, and I tell guys at least sort of every hour or so, just check on the penis, make sure it's straight in the pants, because in the first 48 hours, when the filler is still integrating into the penis and there is a bit of swelling, that's when there's the risk of an asymmetry forming of the filler migrating. So you want to be able to check on it every hour or every couple of hours just to make sure that it's straight. And you can sort of stretch it out a little bit, make sure there's not too much retraction.
That might be a bit odd in the office or in the workplace.
That could present a bit of a problem for some people. So yeah, look, guys may tend to stay home for the first day or two just to be able to do that and to make sure that they have the ability to check on it quite often.
You're fussier than I am, but yeah. Certainly trying to avoid it folding up is really important.
Yeah.
I certainly sort of say, okay, morning and night, I want you having a shower. We provide this antiseptic wash. You don't want to overuse the wash because it's a
Dries out the
surgical
skin.
scrub, and it quite intense, but gets it nice and clean. And then while you're there, have a check, massage it if necessary. If you feel that there's a low point somewhere on the shaft of the penis where there's not as much filler, then massage that filler and push it into that area. It's not that mobile. It's not that easy to do it. And guys sometimes ask, well, how hard do I massage it? And I thought, well, as hard as it takes to make it move. And usually at the end of the procedure it always sounds strange when you say it out loud. Give that penis a good massage and smooth it out. I wonder how this.
I'll take it one step. I take it one step further, Jason. Often show the guys the type of massage needed and the pressure needed to help keep the filler even. And that, of course, is a slightly awkward process, but it's very important.
Yeah. Well, the penis is so numb with the numbing cream that they've had on. So I'm never sure if they understand how firm that pressure is because of the numbness. Anyway, so I get them to do that morning and night, for the first few days, or as long as it takes. Give them antibiotics to take, and it's probably overkill and unnecessary. But I'd rather give it to 1,000 guys to prevent one infection than have the one infection. So yes, use that.
Yep. And then of course we and part of our standard aftercare, guys, this is on a form on a post-treatment care information sheet that we give everybody, but there's a type of ointment. We give an antibiotic ointment that we ask you to put on the entry points at least twice a day, usually after the couple of showers that you have a day that Dr. Jason just mentioned. And that helps those entry points heal up really nicely, and again reduces that risk of infection. And we did mention briefly there, and in previous episodes, that we offer, and we do tend to wrap the penis in a Coban style wrap. That's an elastic style bandage that helps keep the penis straight. The main thing I say is really it's just to help prevent that folding of the penis in the pants, to help give it some symmetry. It can help reduce some swelling, but really it's important not to have it on too tight. That's probably the one thing that I mentioned.
Yeah. So the problem guys make with the bandage is trying to wrap it too tight and then squeeze it in an area which is not good. And it's sort of a useful thing, but it's most useful for guys who don't need it as much. So guys who are naturally a shower and penis hangs out, they find it really easy to wrap and the bandage stays there and it keeps it nice and straight. But for guys who get a lot of shrinkage, and especially if they get a lot of shrinkage, it'll just shrink inside the bandage and the bandage will just drop off. For guys who are somewhere in the middle, it probably is the most useful. They get a bit of shrinkage, but they can hold it in place with this sort of self-gripping elastic bandage, and they can find it really useful. So the guys in the middle somewhere get the most benefit. Yeah,
sure. And that you just mentioned then shrinkage. And guys ask, well, then how do I avoid that happening? And so what advice do you give, Dr. Jason?
Okay, well, there's a number of options here and quite sort of interesting. So there's a blood pressure medication. It's called an alpha-1 blocker, which is medical sort of side of it. And it works by sort of relaxing blood vessels. So when your heart is beating, that doesn't have to beat against this high pressure. And what people have found is that it seems to open up some of the blood vessels into the penis. And for some guys, it's been quite useful just having that increased blood flow into the penis and preventing some of the shrinkage. And so I've used that for a few years for guys who want to try it. But more recently, I've been using some of the medications that guys use to help with erectile dysfunction. Mm-hmm. And I'll mention it. Look, Cialis, the one that you can take, and the effects of it last for 24 hours or so, as opposed to Viagra, which is sort of a more of an instantaneous type thing. And for a lot of guys, that can help with shrinkage. And so for guys who are worried about shrinkage, I'll give them a script for this. It's a low dose. They take it once a day. It comes with a script with, I think, 30 tablets in. So they may just take it for a couple of weeks, and then in 2 weeks' time, in the future when we're doing the second stage procedure, they can take another 2 weeks. Of course, then some guys find that they like it so much, then they don't want to stop. But that's another thing. So I found that medication to be useful. And then there is this interesting finding that Botox, like we inject in the face to get rid of wrinkles, affects the nerves that are related to erection. And so there's a urologist actually in Egypt who's been trialing this as a medication for erectile dysfunction. And some guys find that can then help with shrinkage. The downside of it is that Botox is really expensive, and you need a quite a big dose.
Yeah.
And so
not as easily sustainable to use yourself at home.
No. Well, if you have it once and it lasts for 3 months, then perhaps that's it. But I think Cialis is really a better option. It's something that guys can take as a way of reducing shrinkage.
And I've had some more ingenious methods that some of my clients have actually mentioned or brought up, and have been using their own extension devices or weighted devices to help stretch out the penis. Have you had the same suggestion from your clients?
So it's a common question, because guys who are coming to us looking for an increase in the girth of the penis to make the penis thicker, they usually like the idea of making it longer as well. And Calibre as a penis augmentation treatment is a girth procedure, not a length procedure. Although for some guys with moderate shrinkage, just having that weight of product in the penis will often make it hang out a bit more. So there's a whole range of penis stretching devices, and there's the fireman pump sort of thing, which is obviously a very temporary sort of thing. You're doing it for a few minutes, and it's not helping us sort of more long term. There's the ones with the stainless steel rods on either side and a noose around the glands. And yes, that sort of can be useful, but it's usually not a sort of thing that you can be walking around with during the day. There are ones with sort of more suction caps onto the glands. Potentially they can work quite well for some guys. It depends on what sort of wrapping they use with that, because sometimes they need some wrapping that goes onto the shaft of the penis. Because what we don't want it to do is be pushing the filler that we've used to augment the penis out of the way. And with some of these suction cap ones, you can attach it to sort of like an elastic strap and either go down onto your leg, or interestingly, go over your shoulder and attach onto your belt sort of behind you. And then that's holding it sort of straight in an upwards direction.
Okay.
And so some of these can be useful. And guys, if they have experience with it, sometimes I have guys bringing these things in and showing me their collection of penis lengthening devices. And some of them are worthwhile. As I said, I do think that there is some evidence that you can get length from stretching or hanging. So hanging is sort of where usually with a suction cup to the penis and binding, and then they hang a weight off. That these treatments can get some length. Hanging is not such a great long-term sort of thing. You can't walk around with something hanging off the end of your penis, really. But yeah, I think that there is potentially some usefulness to that.
Definitely. So I think that's pretty much it for the post-op care. A lot of guys are very keen on keeping very fit and exercising every day. So they do often ask me about exercise and what exercises can and can't be done. We really just don't want you to, in the first day, a couple of days when there's a lot of swelling, those entry points still haven't healed. We don't want you working up a big sweat. If your heart rate's going through the roof, the swelling will be made worse. And two, if you're sweating, there's a risk of, making those little entry points dirty and having increasing your risk of infection. So guys, I'm sure you can have a couple of days off, exercise, guilt-free, and know that you're going to get better results from the Calibre procedure.
Yeah, that's right. Trying not to get too sweaty in those first few days. And if you do get any sort of sweatiness, from your work or something, then showers, washing, cleanliness, super important.
Excellent. I think that's from my point of view, it's pretty much all I do talk about in terms of the post-op care. Is there anything else you have to add, Dr. Jace?
No, I think that's it. The last thing I virtually tell every guy when he's leaving is, if you've got any worries, get on the phone. Give us a call.
Exactly.
We're contactable, and I also tell everybody, I'd rather you call me and me tell you, no, that's fine.
Yes.
Than for you to have a problem and not call me because you feel you don't want to, bother me. And the great thing is, hardly anybody ever calls.
Yeah.
But yeah, it's important for guys to know that, we're there to make sure that they get, the best outcome they can get, and make the whole process as easy and comfortable for them as it can be.
Couldn't have said it better. All right. Well, thanks, Dr. Jace. It's been a pleasure being part of the Penis Show today. We are the Dick Doctors, and confidence changes everything.
Great. Dr. Gav, I look forward to speaking to you again soon. Bye-bye.